Before we step into the unknown, we have to lay down the ground rules. What we're about to discuss involves chemistry, history, and the darker side of pharmacology. This is a documentary, not a manual. Many of the compounds we're looking at today are unstable, highly toxic, or strictly illegal. We are here to learn, not to experiment. Stay safe. When we hear the word drug, our minds usually go to the familiar. The caffeine that jumpstarts your morning. The alcohol that softens the edge of a long week. Or the pills in the medicine cabinet that keep the modern world functioning. But that is just the surface. If you dig deeper, beneath the commercial counters and the pharmacies, you find a hidden library of chemistry, a collection of forgotten experiments, ultra-niche medicines, and molecules so strange. Most textbooks don't even bother to list them. Today, we're leaving the safety of the known world. We can't catalog every single molecule in existence, but we are going to open the files on the rarest, the weirdest, and the most terrifying compounds ever synthesized. Sometimes, a drug isn't rare because it's new. It's rare because history taught us a brutal lesson. Take 24-dinitrophenol. Most people just know it as DNP. Go back to the early 1900s. In munitions factories, workers mixing explosives started noticing something strange. They were losing weight rapidly. They were sweating through their clothes, even in the freezing winter air. It turns out, DNP breaks the fundamental contract of biology. Your cells are engines, they turn food into fuel. But DNP sabotages that engine. It disconnects the fuel line. Instead of creating energy you can use, your body just burns everything you eat and releases it as raw, uncontrollable heat. By the 1930s, they bottled this industrial chemical and sold it as a miracle diet pill. And the terrifying thing? It worked. You could sit in an armchair and burn calories faster than a marathon runner. But there was a catch. There is no ceiling to that heat. The dose you need to lose 5 pounds is razor close to the dose that literally cooks your organs from the inside out. There is no off switch, no antidote. It was banned in 1938, vanishing into obscurity as one of the deadliest weight loss experiments in human history. If DNP is about heat, our next compound is about sheer, overwhelming force. What happens when your patient isn't a human, but a 13,000-pound creature capable of flipping a truck? You need a ghost called Etiphine or M99. Think of morphine. Now, multiply that potency by 3,000. That is the scale we are operating on. This substance is so aggressive that it is almost never used on human beings. It exists for one purpose: to stop the titans of the animal kingdom, elephants and rhinos, in their tracks, and to do it in seconds. But for the doctors handling it, the stakes couldn't be higher. It's so toxic to humans that a single scratch from a used needle could be fatal within minutes. That's why you will never see a vet working with M99 alone. They always carry the antidote, buprenorphine, in the same kit, loaded and ready. It's a drug so powerful, it demands respect, or it promises a funeral. When we imagine hallucinations, we think of the visual walls breathing, colors melting. But there is a rare, quiet corner of psychedelic research that ignores your eyes and attacks your ears. This is DIPT. DIPT is a strange anomaly. It doesn't usually send you to another dimension or make you see things that aren't there. Instead, it breaks the audio driver of your brain. People who have taken it report a distinct mechanical shifting of pitch. Human voices drop into a demonic register. Your favorite song becomes a dissonant, terrifying dirge. It takes the familiar soundtrack of your life and detunes it into a horror movie. It's a very specific, very haunting distortion of reality. Finally, we arrive at the modern era of the designer drug. We have a substance with a deceptively cool name, but a nightmarish reputation. It gets the name from the shape of its molecule, which looks like a dragonfly. But the effects are anything but light. Most psychedelic trips have a curfew. They end after a few hours. Bromo Dragonfly refuses to leave. Because of how tightly it locks onto your brain's receptors, the experience can last for 2, sometimes 3 full days. And it is unforgiving. The difference between a trip and a tragedy is microscopic, truly grains of dust. It's a stark reminder that just because something was made in a lab doesn't mean it's clean, and it certainly doesn't mean it's safe. From industrial poisons that burn you alive, to tranquilizers fit for giants, to molecules that warp the way we hear the world, the library of rare drugs shows us just how complex and fragile our biology really is. It shows us that the line between a life-saving medicine and a deadly poison is often just a matter of dosage or a single atom out of place. If you enjoyed this dive into the fringes of pharmacology, make sure you're subscribed and have notifications on. We have plenty more files to open. Thanks for watching.